If it takes a human a year to recover from one round of antibiotics, how long does it take a dog? Hey, I'm Dr. Ruth Roberts. I am so delighted today to introduce you to Audrey Moyna, who is a retired PharmD and now a certified holistic pet health coach. Audrey has a tremendous number of life experiences that made her question what goes on in conventional medicine, and what's going on in veterinary medicine. Audrey, welcome. So glad to have you here. To start with, what made you choose pharmacy?
Yeah, thank you, by the way, for having me here. I'm excited to be here and represent the group of awesome Dr. Ruth's holistic pet health coaches. So thank you for having me. My pharmacy career, so to speak, I decided very young to be a pharmacist. My mother was always sick and I wanted to make her well. And so very young, I said, I'm going to be a pharmacist one day. I'm going to make my mom well. And I never really wavered from that path. And in high school, I took all math and science classes. I knew exactly where I was going to go to college because there was only one college of pharmacy in Illinois at the time. Now there's like many. But yeah, and I knew very early. I did it. I took all the classes I needed to take quickly so I could graduate and go out there. And that kind of started my journey of being a healer, allopathic medicine journey. And it was awesome. It's nice when you know early in life what you want to be and there's no confusion there. I knew, and there was never a question. So that's nice.
That's easy. But so how did you find, and you were in the pharmacy profession for a lot of years, and how did that go over time?
Yeah, so I love pharmacy. So I don't want anyone to ever think I don't love pharmacy. I love what I did as a pharmacist. I love helping people with their health on their wellness journey. But I actually had two like big aha moments in my adult life. My first aha moment, which wasn't as much, it wasn't about pharmacy, but my first aha moment was I was created to do something with animals. And it was always like in me, it was tugging in my heart. When I graduated from pharmacy school, I said, I want to be a cat behaviorist. And obviously, you can't just become a cat behaviorist with no training. I had a lot of student loans. And so I became a pharmacist. I was never a cat behaviorist. But that was really like one of those things in my life. I'm supposed to be doing something with animals, and I don't know what it is. And it was always inside of me. And then a second aha moment, and this is really what kind of started me on my journey of holistic health, was I started realizing that the sickest people I knew were the people that were taking a lot of medicines. Over time, you start realizing that there's a lot of side effects to medicines, and the long-term side effects get even worse. And sometimes those side effects are worse than the condition itself. And then people take more medications to counteract the side effects. And so now they're on many meds and they have drug interactions. And you get to the point where you can't quite figure out, is it the condition or is it the drugs that is making somebody sick? And true story, a friend's mother-in-law was put in hospice care. In hospice, we think that someone's going to live about 6 weeks, whatever it is. They stopped all her medicines, which is common for holistic care, and they just left her on pain and anxiety meds. And she got well, and she left hospice and lived another 3 years. And that really, and I know that is not the norm. And so please don't anyone think I'm saying, stop all your medicines and you're going to get, that is not what I'm saying. But it made me question, are people on a lot of drugs because they're really sick? Or are people really sick because they're on a lot of meds? Some of the healthiest people that I know, I don't know about you, but the healthiest people that I know, my mother being one of them, don't take any medicines. And so that kind of got me thinking. And then it was about 10 years ago, I started learning about essential oils and the therapeutic properties of essential oils. And I was like, this is fascinating. They have the same properties as drugs without side effects. And they didn't teach me this in pharmacy school, nor did they teach me any botanicals or anything. And that, again, that was a real aha moment for me. I'm learning about all these oils, the therapeutic properties, And that is where I made the decision that for me and my family, we were going to start utilizing more natural, holistic options to treat ourselves. So I'm not going to pop a pill for every ache, pain, and sniffle. We are going to try natural things before we do that. And so that kind of started my holistic journey, was, some of these aha moments about side effects with drugs and then learning about essential oils.
That's amazing. So just out of curiosity, I mean, we say holistic a lot, right? But what does holistic mean to you? And this is a ringer question. Sometimes we think about it, sometimes we don't.
Yeah. When I think of holistic, I think of more of a broad way of treating someone rather than, when I think of allopathic, I think of here's a symptom, I have an itchy ear, I have to treat it. Whereas when I think of holistic, I think of the whole being. So I think of what is the diet, what are the personality types of the animal or the person. I think of using more plant-based products to help to treat me and my family. So my family right now, we look at nutrition, we look at supplements, we try to heal the gut. Those are some of the things we look at when we think of holistic, rather than, like I said, seeing that I've got a rash on my arm, I got to smear some cream on it and it's going to go away. To me, what's the rash from, right?
Right on. And said, because that's the path, the way of allopathic medicine is to look at the symptoms in isolation instead of what else in the body is not in harmony or homeostasis that's creating that symptomatology.
Exactly. Yeah.
So that's cool. And that's the difficulty, even with what a lot of people would consider to be holistic medicine, is that we're replacing the pharmaceutical pill with the supplement pill and still working at the level of symptoms rather than at the root cause.
Right. So, and when I can say that is almost part of my journey also, right? My journey was, I'm a pharmacist, you use a pill. And then I learned about essential oils, right? And essential oils, now instead of taking a Motrin for my headache, I'm going to use peppermint for my headache. So it's a continuum. Now, when I think of holistic, right, when you go further down the spectrum of holistic, if you say you have a headache, I don't say use peppermint oil, which, by the way, it's great for headaches. But now I say, okay, why do you think you have a headache? Might it be hormonal? Might you be dehydrated? Are you under a lot of stress? And so I'm looking at the person, again, more as a whole person before I say what oil you should use. All right. So that is, again, allopathic is take a Motrin. Going towards holistic, it is use peppermint for your headache. And holistic is, what is your headache from? Right? What other things are going on in your body? What led up to the headache? So we can figure out you might just need to drink a bunch of glasses of water, right? And not need anything. Yeah. And so that is where I view that continuum of allopathic all the way to holistic. Sweet.
Yeah. And that's exactly so. So long story short, you retired, you started doing aromatherapy. Mm-hmm. And then how did you go from, all right, I need to really do something with animals, I need to be supporting dogs and cats? How did that start to come up for you?
Yes, obviously it's come up my whole life, and I've said, I've got to do something. What is it? And like you said, I retired in October. I knew now is my time to do more with animals. So I was excited for that possibility. I had been practicing aromatherapy, right? So I've been practicing animal. I'm a certified clinical animal aromatherapist and certified clinical aromatherapist. So I've been doing that with animals for a while. I've been doing it with people. So I've been doing that. But one of my you're going to laugh at me, but like one of my aha moments, and it was right, like you had that perfect storm. Like I retire on October 15, and I don't know how it is. I find some article about Bobby, the oldest living dog. And he was 31 and a half years old when he passed away.
Más o menos. I think Guinness retracted his record.
Yeah. So
whatever. He was old.
Right? And I'm like, yes. I want my dogs to live that long. That's right what I'm thinking. And I was like, gosh, I wonder, what did they do? And I watched an interview with his owner. I don't know. We just fed him what we ate. So he ate people food. And he gets out, gets fresh air, forages, and doesn't get any vaccines. They live in the middle of nowhere. Not a lot of stress. They live on a farm. And I was like, that's fascinating, right? So that is, right? That's like taking like holistic, right? Here's Bobby, he's over 30, whatever it is. And so that's when I was like, I want to figure out how to do that for my pets. And again, Bobby's my inspiration. And then the perfect storm, I don't know how, but I saw Dr. Ruth, one of your programs, and I'm like, oh my gosh, this is it. This brings like the full circle for me, right? I'm a pharmacist. I know I'm supposed to be doing something with animals. I like being a healer. I like using more holistic approaches since we started using essential oils and more with diet. And then I saw Dr. Ruth's program, and it was like I said, it's the full circle. This brings it all together. And I was like,
Wow.
woot. And yes, I started the program in November. One of the greatest decisions I ever made because I learned so much. So thank you to you for all that I've learned through that. And that really, to me, brought everything together. Now, my dogs may not live till they're 30. Okay. And I understand that. But I didn't know about the importance of diet and all those kind of things till 3, 4, 5 years ago. But I know that my dogs are going to live a lot longer, healthier lives than if I continued to do what I did with them 10 years ago.
Amen to that.
The program. Yeah.
Right on. So this cracks me up from Karin, one of our fellow holistic pet health coaches. He was, and do you know what actually Rodney Habib said to me? He was eating boiled vegetables was the majority of his diet.
Wow.
Yeah, because if you look at Portuguese diet, their animal products, they are about 17% of the human's diets. And the majority of those there's a lot of cured meat. So I can guarantee you Bobby was getting the offal, so to speak. So the glands, the organs, the things that people wouldn't eat, plus whatever was probably about to go sideways. But the majority of his diet was boiled vegetables. So there you go. Fascinating. And that
I'm going to name my next dog Bobby, by the way.
Right on.
That's my decision. Yeah.
Cool. I don't know how your cheese are going to feel about that.
Yeah, no time soon. No time soon.
Yeah, exactly. So, because they're going to live forever. So one of the things that is super, super interesting is the other issue with allopathic medicine. It is amazing. If you have been hit by a car, if you've had a heart attack, if did some terrible, awful trauma to yourself, it's great for that because it's set up to react to emergency situations. But where in allopathic medicine do we find true preventive medicine?
Yeah, that's a great point. Like you said, allopathic medicine, I'm a pharmacist. So when I think of allopathic medicine, I think of a medicine, and we are going to treat a symptom of a disease, right? And that is putting a Band-Aid on if we have not figured out actually what's wrong, right? If I just I've got an itchy ear and I just put a cream on my ear, but why do I have an itchy ear? We're not necessarily treating the illness. We're not treating the animal or ourselves as a whole. And so that is where I like looking at like allopathic. Yes, they're going to diagnose, but I like to look at more holistic look at my animal as a whole. What is he eating? What led up to the issue that he's having right now? It just doesn't come out of the blue. What's my pet's mental state? Is he really worried? Is he under stress? Does he have other illnesses? What's my animal's personality? This is one of the interesting things about Dr. Ruth's program is learning traditional Chinese veterinary medicine. So looking at their energy, their personality, and how do we treat that? Looking at the environment. Is your environment conducive for healing for your pet? If your pet comes home from surgery and you have a household that is frenetic and loud and stress-filled, that's not a great place for someone to heal. And I think about the environment, the toxins in our environment, the toxins outside, the toxins inside. I just have to put a plug in here because I say it anytime I have a chance to. If you have Glade plugins in your house, please get rid of them because they're toxic. Okay.
They are.
I have to say that because it's one of those things that like needles on a chalkboard. Get rid of toxins in your house. How do we determine, like you said, how do we bring an animal's body back into balance, into homeostasis? Because that is how we're going to help them to be healthier for longer. And that is how I view holistic is keeping our pets healthier longer by balancing their body.
Amen to that. And thank you for the reminder about Glade plugins. When those things first came out, I had a client bringing in his cat to me. And so I'm asking him, hey, do you have any of this, of that, of the other? And he said, yeah, my wife just got these Glade plugins. And I'm like, please ask her to throw these things out. The cat was having asthma symptoms. He said, could you write that down in your notes for her, please? And I said, well, yes, I'm happy to. And I said, why? And he said, because they're giving me asthma too. She'll throw them out for the cat, but not for me. So, I'm like, you have special permission. And here's the signed note. I'll write you a prescription for that. Throw the plugins out, please, madam. So it was just hilarious. So when you're starting to work with somebody that's just, holy smokes, my dog just got diagnosed with X, whatever the X is, what do I do? What are some of the first things you start speaking with to people?
Yeah, when I think about working with animals and trying to look at things more holistically than allopathically, again, allopathic's not bad, but first thing we think of is diet and nutrition, right? If we are feeding highly processed kibble, everyone listen, if we're feeding highly processed kibble, that is pro-inflammatory. Okay, you are causing inflammation in your pet's diet or in your pet's body. It's very high carbohydrate. I always say it's like me and you having Oreos at every meal. No one's going to have a healthy gut if they have Oreos at every meal. So the first thing we look at is diet and nutrition. If you listen in on any of these Dr. Ruth things, you will hear all of our coaches say the same thing. We talk about nutrition. If we don't have a healthy gut, we've probably got a lot of bad things going on in our body. It's so funny because when you're a kid and your parents said, don't eat sugar because it'll cause that zit. And I'm like, that's ridiculous. How would sugar cause a zit? Now I get it. And if our gut isn't healthy, then we're not healthy. So first thing I think of is diet and nutrition, whole foods, like human grade food, not feed grade food. I like to cook for my dogs. I cook Dr. Ruth's Crock Pet diet for my dogs, which is, it's fun. It's fun cooking. I give some of my dogs raw, but I really look at diet and nutrition as one of the first things I start with when working with animals and trying to figure out if you've listened to any of these, changing diet has completely improved things for so many animals. Allergies, skin conditions, so many things that diet is going to make better.
Amen. And I think almost every coach has the story of working with a client that has a dog that has been on Apoquel for some period of time, right, and changing the diet, using a supplement to help support reducing the itch and getting that dog off of Apoquel long term. Yeah, that's sweet. And you're correctly pointing out allopathic medicine does have its benefits. If your dog has inflammatory bowel disease or something more serious like autoimmune hemolytic anemia, your dog needs those emergency drugs of prednisone to get that under control so they don't die. And then the next step is to figure out how to support the body to return to health.
Agreed.
Right on. So you've already mentioned you're doing aromatherapy, but what are some of your first line supplements that actually are going to help bring the body back into homeostasis?
Yeah, so I love using herbs and supplements when I can. Like you said, I use a lot of oils for digestive pain, anxiety, infection, allergies. So I use oils a lot. I use supplements a lot. I love omegas. Omegas are great anti-inflammatory. Something as simple as some sardines in water. Great for animals, and they love them, even though they stink up your whole kitchen. But I do a lot of omegas with mine, probiotics to help heal the gut. I like to use digestive enzymes, CBD and mushrooms. They're awesome. Some people are wiggy on that, but we definitely promote CBD and mushrooms. For me, again, it's stuff that comes from plants, not synthetics, that are really going to help to heal our pets. So we do a lot with supplements if we can, to try to, again, bring their bodies into homeostasis and help them with different conditions.
Right on. And one of the other thing I think that is so important is when veterinarians are limited to a 6 to 15-minute appointment, how is it that you, the holistic pet health coach, can really help that pet client understand, or the client understand, what is going on with their pets? And part of the training is in digging down to the root, but what are the sorts of things you might ask somebody?
Yeah, like we do actually get the lab results from the vet. So we do take some of the assessment from the vet. We want to know what the vet has to say and that. But like Dr. Ruth said, we are looking at things like the diet. What are they eating? Their environment. Again, we look at traditional Chinese veterinary medicine. What is their personality type and their energy? Again, I think some of it is trying to figure out what led up to something. It didn't just show up. He didn't just all of a sudden get like a scratchy ear. Something led up to that. So how do we do more in looking at that? And again, we do a lot with nutrition. We use something called the Glacier Peaks stress test to determine sensitivities to foods. And so if we're having a lot of allergy issues, tummy issues, digestive issues, we need to figure out what foods or what things in the environment they're sensitive to, so that we are able to create a diet. That's why the crock pet is so great. We can create a diet specific to our pet, right? I know that my dog can't eat broccoli and he can't eat beef. I create a diet specific for him. So that is one of the first things we do, is we, again, try to figure out what are the sensitivities, use that, come up with a nutrition plan, and then incorporate supplements and essential oils and other holistic modalities to help, again, bring our animals back into balance and into homeostasis. My goal is always, if they're on a medicine, you mentioned APIC, for me, it's like if they're on painkillers, are there things we could do naturally that over time we can start reducing their dose or get them off of those meds? And again, please don't take your animals off of any medicines without talking to your vet. But that's my goal, is like, what do we do to help them to move along the spectrum and not have to stay on those as long and possibly get the side effects associated?
Right on. And I think that's just so crucial, is that when I first was in veterinary school, what they trained us to do was to ask questions and listen to the answers to find the thing that was the inciting event that created that whole chain reaction. And as I said, my veterinary colleagues are in a situation where they have to get through an appointment within 6, 10, 12, 15 minutes. There's just no way they can get through that without just doing the basics, in terms of, I got to do the exam, I got to get the prescriptions written, I got to get the blood drawn, and that's your 12 minutes and you're out the door with no explanation. So
and I also think part of taking that, the triage or whatever you want to call it, we as holistic pet health coaches, it's okay, what else? Okay, what else?
Yeah.
Because when I'm in my vet's office and I get my 6 minutes, when I've got the best vet ever, by the way, I don't think of all the what else's until I'm in my car and I'm like, oh, I should have told her he did this. Oh, I should have told her he did this. And I forget because I only got 6 minutes. And so I think with the holistic pet health coaches, we do more about what else? What else did you notice? Oh, did you see this? Does he have any of these symptoms? Oh, yeah, he's got that and that. Okay. So it's really trying to, again, try to capture everything you can.
Exactly. Dialing it down. So I think there are, apologies, I'm skipping around through here so I don't miss anything. But what we're talking about basically is working with veterinarians and integrating both the allopathic concepts and the holistic methods. So there's a lot of benefits to that. But how does that seem to work when you're working with your own pets or working with your clients' pets?
I think that's the answer, is using both, right? We need to integrate both the holistic, because holistic benefits allopathic and allopathic benefits holistic. And so you have to work both of them together. I think we definitely have to take advantage of allopathic medicine. We need a diagnosis. We need drugs. We need surgeries. We need procedures, when sometimes we just need a really quick response. An animal has inflammation. A new diet is not going to stop that inflammation overnight. I love using Pets Pemp. I like using light therapy for pain. When my dog came home from surgery, it's not going to work overnight. I still have to give him his carprofen, right? So it's a matter of like, I like to acutely use the medicines that need to be used and then continue doing the more holistic stuff to continue to heal them so that we can wean them off the meds. If we've done all we can through holistic means, I've done my light therapy, I've done my PEM, I've done my essential oils, and they still need surgery on their, whatever it is, CCL or whatever, then we need allopathic medicine. We need Western medicine. We need procedures done that have to be done. I just try to do things earlier, try to not get there. Again, if there's an emergency, you said it, if my dog gets hit by a car, we got to go to the vet.
Period. Yeah.
I don't care how healthy his gut is. So I think that there's a lot that we need allopathic medicine for. The benefits of holistic is looking at more preventive care. So how do we look at the animal and their health span or lifespan? How do we get them to live longer, healthier? And a lot of that has to do with knowing your dog. If we know our dog breed, right? My dog breed tends towards hip dysplasia or arthritis or heart disease. We can start doing things early. We can start giving omegas. We can start doing things earlier in the process, more preventive care, and not wait for our animals to suffer. And we have to go to the vet, right? I don't want to get to that event where we have to go to the vet. If your dog has allergies, don't wait till you're in full bloom to start doing something about it.
Right on.
When you're blooming. So start things earlier. So that's where I look at, I think they both come together so well for their own purposes. And when I look at the more holistic approaches, I look at preventative and getting the dog in balance. And like the stronger a dog's immune system is, he's going to ward off a lot of stuff. And again, what we do through the gut.
Right on. And that's a really important point too, because again, medicine, both on the human side and the veterinary side, has trained us to wait until things get pretty bad before we do anything. But the reality is, and Dr. Jeff Feynman's been talking about this to us, is that the symptoms are exactly that, the early warning signs that, hey, something's not working. And Jeanette is saying, oh, my baby boy has a sensitive tummy. And that's a really common thing. But what tends to happen is my dog has a sensitive tummy. He vomits twice a week. Oh, now he vomits 4 days a week. Oh, now he's having diarrhea 2 days a week. Oh my God, now he has IBS. And so the place to start supporting your dog is when you notice that something's not right, when he's vomiting twice a week, and really look at why is that? And, so good for you, Jeanette, for figuring out that he's got some food sensitivities. But if that's better, but still not normal, this is where a holistic pet health coach can really help you. And this is what Audrey's talking about. If you use food sensitivity tests, do rotation and elimination diets, and really try to get that immune response to calm down, to get the gut to seal and heal, then we can really make a big difference and return a dog that's suffering from occasional symptoms that may be starting to ramp up back to a state of health. So cool. And Janae is
she's one of my,
she's your pal. Right on. Right on. So this is amazing. So her dog had seizures since she was a puppy. She went through some aromatherapy with you. And now that's amazing. She's gotten her to where she is only had one breakthrough seizure in 12 months and took consistency and time. But that's amazing. So well done, Audrey, and well done, Janae, for sticking with it. Because it's frustrating, right? We want that pill that's going to make it all better right away. And it just doesn't work this way.
Yeah.
And cool. And Jeanette, that's wonderful. If you did a sensitivity test on him, that's fantastic. What I would encourage you to do is find a couple of other proteins, because what tends to happen is if the gut hasn't healed completely, eventually he's going to become sensitive to turkey as well. So that's the frustrating thing we don't realize. Oh, he can eat turkey. Okay, we'll just feed him turkey. And then 3 to 6 months later, he can't eat turkey. So crazy stuff. Cool. I think we've got a couple of questions in circle. So let's take a look over there. If I can find this. Yeah, Chrome tab. I think it's looking for the wrong one. Let's see. Let's just do it this way, since I'm not smart enough. So let's take a look over here. And Mandy is asking about her 2-month-old puppy that came to them coughing. And it looks like some of the coaches have jumped in on this. Mm-hmm. Breeder gave him amoxicillin to treat it, but the coughing didn't go away. He was given some more antibiotics, some more, both amoxicillin and Baytril, which is stronger, and then x-rays, et cetera, et cetera. I think a lot of folks have jumped in on this, but the coughing's gotten better when he started, but he started coughing up again 2 days ago this morning. What else could she consider? And I know your background is essential oils, and so this may be a little kinder and gentler way to approach this.
Yeah, and I've seen, like, a lot of the coaches had comments, different products. Breathe, mushroom tincture was one of the things I know people were talking about. There's actually essential oil called Breathe as well. So I would diffuse essential oils. I'd probably use a different one than Breathe. It's called Airx. But yeah, you can diffuse essential oils to help that, and also use essential oils as antibacterial, because it doesn't kill the gut. So right now, little puppy has had a lot of antibiotics. So besides trying to get the cough under control, we're now going to have to work on the gut after we get the cough under control, because all of these antibiotics have probably hurt their gut, their microbiome.
Right on. And so that's a really interesting point, right? We think, oh, we need to do some probiotics. When ideally would she start probiotics? That's a tough one.
Yeah, it's a little guy too, isn't it? Only like a couple.
I think so. He's only a couple of months old. Yeah.
Personally get worried that young, but I would probably start like a raw goat's milk now, because there's so many benefits of raw goat's milk, and I love using that. What are your thoughts, Dr. Ruth?
That totally makes sense, because at this point we want to wait until the antibiotics are finished before we start any probiotics, because interestingly enough, if you haven't started them along with the antibiotics, it evidently takes the gut longer to return to a state of homeostasis with probiotics after antibiotics have stopped, rather than waiting for a few weeks to let things settle out and then starting probiotics. But by feeding probiotic or fermented foods, that's a great idea, because you're going to get the prebiotics, the probiotics in smaller quantities, and then postbiotics. So we're really setting the gut up for success.
It's interesting. I'd read it. This is a People article, not a pet article, but it was a People article that talked about after one course of antibiotics, it takes a human's gut about a year for their flora, their normal microbiome, to come back to normal.
Exactly.
Like, that's crazy when you think about some of these kids who are ear infection and their antibiotics every other month. And I'm like, that's scary.
For years at a time, right on. And that's the thing. One of the probiotics I really is Megaspore. And part of the reason is that it's been shown if you start it along with or before the antibiotic, it actually seems to protect the microbiome from getting destroyed by the antibiotics. So a good option there. Mm-hmm. Bernadette, welcome, an RN and living in New Jersey, and your husband and your Goldie and Golden Doodle, Oliver and Chloe. Hopefully we will give you the information you're seeking here. And I think you've got a lot of folks jumping in to welcome you. The other thing I want to point out here, this is our Circle group, which is a private community. It is completely free to join. We have this because we can interact with you on a much more personal level than we have a holistic pet health Facebook group of over 46,000 people, which gets a little crazy in there sometimes. But this way we can give you a much more sort of personal response and help guide you. And please understand, what we're here to do is to give you some places to start, but realize if your dog's had inflammatory bowel syndrome or something like this for 6 months or a year, it's not going to be take this supplement and get better. You really need someone to help you be guided through that process of healing. So like Audrey said, IBS, your dog's probably had metronidazole. If it takes a human a year to recover from one round of antibiotics, how long does it take a dog? And I think the best estimates are somewhere in the order of 3 to 4 months at this point. So really important. And, oh, yuck. Rip Dewclaw. Elizabeth, sorry. Hopefully this is getting better. I hate these because we do need to sedate these guys to trim it. So that's often something you need to go to a vet for. So Teresa's asking about, and looks like actually coaches have gotten in here and really chunked down, but I think these are great questions for folks to know about. So the Crock-Pot recipes mostly feature beef or chicken for proteins, but her one puppy is sensitive to the normal proteins. So is she going to need to make changes in the diet if she uses something like pork or bison or goat?
With the Crock-Pot diet, again, if you look at the Crock-Pot diet does give you, it says 3 pounds of protein, and you pick your protein. And we rotate our protein so we don't get sensitive to them. So if you are doing the Crock-Pot diet, you can use any proteins based on what your Glacier Peaks test showed your dog does not have sensitivities to. So you could use whatever protein you want in that.
Right on. And the one codicil is fish. You need to use about a half a pound more just to get enough protein equivalency for other animal proteins or mammalian proteins. Yeast protocol. What do you think about yeast, Audrey?
Admittedly, I can't read the screen because it is too small for me. So,
okay, let me read that. She's 290. Hey, let me help you out there. So 9-year-old cockapoo started having ear infections and red coloring around her paws since she's been misdiagnosed by her vet and put on 2 rounds of antibiotics.
ouch.
She's on raw, no chemical, fleas, or worm treatment. She just ordered a new single protein raw food, which she's never had before. Shall I leave her from time being on the new raw food without adding anything else? Or should I add some oils, fish, veggies, mushrooms, kefir, etc.? What do you think? And she's going to do the yeasty beastie protocol.
Yeah, I don't know. I don't think it said it in there. Again, my goal is to do a Glacier Peaks to find out what they're sensitive to, because changing, if we don't even know exactly what bothers them, it is hard. I had a client that had a lot of issues. They did the Glacier Peaks. We knew what they were sensitive to. And she started with a specific protein and 1 veggie. And that was in the oil. And she just started there. And then she added another veggie. And that was her way of she slowly worked up. She tried this. I think it was kale. And she said, yeah, no, he got bad on that. Okay, now we know it. And she had the Glacier Peaks also. So she used that as a guideline. But she slowly added things in because, again, if you add everything in, this and this, and you don't even know what they're sensitive to, then we're never going to know what they're sensitive to because we have so many things. So I start with the food and the nutrition. I do then, if they're, did you say they're doing the yeasty beastie? So they're doing a protocol on that. I'm going to say I'd want to do a protocol to heal the gut also. And so it sounds like they're doing that. And then making sure we have the right foods and proteins and veggies and oils that the dog doesn't react to. I also, and again, I can't see some of them. I like to use, if we've got really yeasty areas, I like to use green clay to soak some of that out. It's relatively benign. You just put it there and it draws stuff. So
that's a great point because you can use things topically to support skin disease, to suck out the evil spirit, so to speak. And the other thing to remember too is that yeast is a secondary invader. It's usually not the primary reason why there's a skin issue. And so some of that saliva staining gets mistaken for yeasts. Now, the issue is that this poor pup's had a couple of rounds of antibiotics, so probably yeast is what's left there. But I think it's important to really approach it from one step at a time. It's just really frustrating because we've had this approach of take this pill or take this supplement. And it turns out that we're seeing sensitivities to a lot of supplements that we hadn't seen for a number of years. But yeah, that's a dog where, if we know nothing else, you could use some quercetin to cool the itch down. Apple cider vinegar rinses and that kind of stuff can be amazingly supportive as well.
And I use salt with essential oils in them and do soaks with that as well. And yeah.
That's it. So there's a myriad of things available to us. But yeah,
but if we don't heal the gut, it's not going to go away.
Exactly. So your friend Janae has got suggestions for stomatitis, and this is a tough one. Since a kitten and their kitty is now 4 to 5 years old, this just drives me bananas. I'm so sorry. So diet is good, using oils, etc., but he needs his teeth cleaned, and the vets told me that they usually won't clean the teeth of an animal with stomatitis. They just pull the teeth, and I'm trying to avoid that. That's a pretty all or nothing result. So what might you suggest? That's a tough one.
Yeah, I got to tell you, I've got nothing on this one because, again, I would do oils and diet. I'd love to hear what you have to say on this one.
So the thing that's interesting is stomatitis is usually related to herpes virus infection, calicivirus infection, or FIV infection. And if it's herpes virus, a lot of times, crikey, the word's escaping me at the moment, you can use, for Pete's sake, the amino acid that starts with an L.
Lysine?
Lysine, exactly. Thank you. And there is a flavored version for cats. That may not be enough. And remember, what's happening with stomatitis is there's inflammation in the gums, yes, but there is also activity of osteoclasts, which are the cells that are responsible for remodeling the bones, and in this case, the teeth. And this is why your vet's saying we usually just pull the teeth, because often what's creating the inflammation in the gum is these little osteoclasts are busy destroying the enamel of the teeth under the gum line. And so it's terrible because we'll anesthetize these guys to see what's going on, and their teeth are literally breaking off because the underneath is just destroyed. But if this is just starting, it's possible to use other things. For instance, you can use a PetSpinf mat, which is a pretty easy way for kitties to take some sort of pulsed electromagnetic field therapy. All they have to do is lie on it, and often they really enjoy it. And in that mat, you can use the pain setting and then the advanced recovery setting as well. If the cat's going to sleep on it, you can set that for up to 8 hours. And then the other options would be to use, Beth's favorite is ozone mouth rinses. If you can find a product that's got like an ozone oil or water, you can use other things that are going to reduce inflammation. So again, omega-3 fatty acids, immune support, all of those things are options. And I had a kitty that was 17 that we were able to keep her from going through anesthesia using a myriad of resources, but it does take effort for sure. And yeah, that's cool. So in Frankie's, I don't know this one, Muterol, but I'll take a look at this drug. But I imagine that it is a monoclonal antibody drug. Good. So negative on FIP. Yeah. So FIV is in Victor. So feline immunodeficiency virus. And yeah, great. So Janae, that's all great options. And then Beth, one of our colleagues, holistic pet health coach, is an ozone maestro, so she's used this tool and in fact has a device at home. So those are all options. It's really hard when we get it's this or that response. And then that sort of scares you off of taking action. Cool. Yeah. So I think that's what we have for today. Any parting comments you'd want to share, Audrey, with everybody else that's going here? I think we've gone through most of the information.
Yeah, again, I just think that if you want your pet to live the longest, healthiest life that it possibly can, we just really need to look at an animal more holistically. We've got to feed them good food or they're not going to live. We have to look at, are we over vaccinating? We have to look at, what does our environment look like? We have to look at, are we giving them meds? Are we giving them things that are toxic? What are we using? Laundry detergent. There are just like so many things. What type of water are they? We use like you, Dr. Ruth, we use a Berkey filter. And there's so many things that we can do and look at that can help to make our animals live longer, healthier lives. And a lot of them, they're just not that hard. It's not that hard to throw out your Glade plug-in. It's not that hard to change to a laundry detergent. I don't know about you. My dogs sleep in my bed. I don't want to use a laundry detergent or dryer sheets that I know have got the bad stuff in it. And so there are things that you can do that are relatively easy that can really go a long way to improve your pet's health. And there's so many supplements that we can use to help prevent things that might happen to a dog just based on, we know I have Chihuahuas and what do they tend towards, luxating patella, whatever. So what am I doing today, right, to help them so they can help that, or collapsed trachea? What am I doing today so that we don't get to that? And so I think there are just so many things that we can do to help our pets live longer, healthier lives. And obviously, first step is nutrition. I don't want to keep beating the dead horse, but that really, we got to heal their gut. Let's heal the gut and let's make them well. And then a lot of other things we can use that aren't poisonous and that aren't causing side effects in our pets.
Amen to that. Cool.
Yeah.
Audrey, thank you so much. This has been really awesome. Lots of great info. Thank you all for joining us, and we look forward to seeing you next week. Take good care.
Bye, guys.